Hi, Dr. Yearling here, and welcome to a guided concept map on the characteristics of infectious disease. As always, I hope you find yourself in a comfortable place where you can focus your attention without distraction. We need about 10 minutes of pure focus so that we can make the most of our time together. You'll also want to pull out your favorite active way to build these concept maps, writing on a piece of paper, writing the glossary terms onto sticky notes and moving them around, whatever you found to be the most engaging for you and interesting. Before we get started on the characteristics of infectious disease, let's look back where we've come. So our entire focus for this unit is the human-microbe relationships. We started off by learning about the world of microbes, the types of microbes, the human microbiome relationship as the starting point. Bacteria and viruses are major microbes that we're going to learn about. So the next thing we did was we learned about their structures and the functions. Now we're going to learn about the characteristics of infectious disease, and you'll see a lot of terms that are probably familiar to you, but let's make sure that we are distinguishing terms that sound similar and making sure that we have the scientific accurate understanding of what those terms mean. Let's get started. Okay, so here is our concept map and the terms that you'll be asked to place. If you'd like to pause and write these terms down onto your post-it notes, do that now. Okay, so I divided this into two major topics, pathogens and exposure. Remember, we like to chunk information, as brain science tells us, that can help us with retrieval later on. So let's start with pathogens up top. Now, look at your definition of pathogens, or if you have that term memorized, say that definition out loud and decide which term you think should go here. You might have a different one than what I have, and it could still be an accurate concept map. But pick a term up here that you think fits best when either reading or reciting the term or the definition of pathogens. Okay? I chose the term infection. So pathogens are microorganisms that can cause an infection. Maybe you chose disease. I did not, because here's why. Do all pathogens that infect cause disease? Maybe it was a little bit of a leading question if you answered no, you're correct. So let's restate that a little more directly. A pathogen that infects can cause disease, or the individual could be without disease, in which case asymptomatic. So an asymptomatic person is infected with a pathogen but does not have disease. Whereas you can have a disease state caused by an infectious pathogen. Okay, so let's learn and build out more from disease. We learned about 3 clinical presentations of infectious disease state. Can you find those and put them on there? Okay, if you haven't done so, pause, but let's look. We have acute period, or acute presentation of the disease. We have chronic presentation of a disease. And then we have latent presentation of an infectious disease. So those were 3 that we were introduced to and the characteristic of infectious disease activity. Let's build out acute because they showed us periods of acute disease and had us put them in order. So I'd like you to take these terms, pause the video, and place them in order, the periods of acute disease caused by an infectious pathogen. Okay, so let's go through the answer. The first period is incubation. The second period is the prodromal period. The third period is illness. The fourth period is decline. And the fifth period is convalescence. Maybe you could come up with a mnemonic to help you remember this. Here's a silly one. Icky pirates invade delightful coves. Okay, so that's the order of the periods of acute disease from an infectious pathogen. Great. So we've parsed out pathogens that cause an infection into those who cause disease and to those who do not, asymptomatic situations rather. So individuals who are infected with the pathogen but do not have a disease state. There's one other thing coming off of disease that we did learn about, and that was the diagnostics that you might be able to get if a patient were to come in. What terms might fit for helping you distinguish an infectious disease? Okay. We have symptoms and there's signs. Now, those are the two things that can be used to help you, and that's why we're asked about our signs and symptoms when we go in when we're sick. Which one is a sign? Which one is a symptom given the examples? Okay, you ready? So anything that you can measure is a sign. Anything that is subjective or the patient feels is a symptom. Signs and symptoms. All right, we just have a few more terms up here, and they go under the concept of what I call exposure. So we have different ways we can be exposed, and I gave you one here that's not hidden, non-living. And I gave you an example of a non-living infectious disease, tetanus. Of the terms remaining, which ones best fit here on the concept map? Okay, if you said non-communicable, you are correct. That is an example of an infectious disease that cannot be transferred between people. It came from a non-living reservoir, often, let's say, through soil that's been contaminated with the pathogen, and it can cause tetanus when it enters the body, and tetanus cannot spread. You can't catch tetanus from someone. All right, what are two other ways that we can be, or three other ways rather, we can be exposed to pathogens? All right, are you ready? Let's check your answer. So we have humans. It's probably pretty obvious. Can be a way that we're exposed to pathogens, as well as animals. And then one that we're pulling out because we're in a medical microbiology class for allied health majors, healthcare associated infections. So for healthcare associated infections, we've reached the end of the concept map. Let's talk about the four major ways the CDC identifies as how healthcare associated infections occur. Surgeries, central line associated bloodstream infections, ventilator assisted pneumonia, and catheter-associated urinary tract infections. So if you're going into healthcare, those are ones when you're learning about that you want to pay extra special attention to avoid or to reduce the risk of healthcare-associated infections in patients undergoing those interventions. Okay, so now we come down to the last two terms. Coming off of humans, we have a blank, and then I give some different examples. Which term should slide over there? All right, communicable. So any disease that passes between two people is considered to be communicable. And I gave you two different examples. HIV/AIDS is a communicable disease because it's acquired by human contact. However, it is not highly contagious because it is only acquired through intimate contact, not indirect contact like through toilet seats or shared drinking glasses. So we wouldn't consider that to be highly contagious, like the flu, which someone can get through droplet transmission and possibly even a little bit longer distances. So the flu is an example of a contagious, communicable disease that is spread between humans, and that's how the person is getting exposed. All right, and then down here we put in our last, zoonotic. So when someone is exposed to a pathogen by animals, We will call that a zoonotic, and an example of that we're all familiar with is rabies. All right, thanks for watching. We're at the 10-minute mark. Like always, I encourage you to take a break, study something else, go for a walk, do something that gives your mind a chance to take what you've just learned and make it a little bit more permanent. Then come back, teach yourself, walk through your concept map that you just made, or even better yet, if you're a little further along, practice building the concept map on your own. Bye for now.